Brand new tonight at 5:30, doctors are warning parents about an alarming trend. They're seeing a rise in mental health cases for children and say it's because of the pandemic. Channel 3 Eyewitness News reporter Shante Passmore shares what signs you need to watch for and what you should do if your child needs help.
George NOUJAIM is like a lot of parents right now. He works while juggling his children's coursework when they're in remote learning.
It's just more of like brain teasers and things like that.
Also during the pandemic, the father of 4 is constantly watching out for not just their physical health, but their mental health.
Watch for any anxieties and depressions. You have to really watch out for things like that.
8-year-old Chloe tells me she's felt lonely on some days. I ask her if she misses school.
Yeah.
And why?
All my friends.
The isolation of being away from friends in a routine schedule is taking a toll on many children.
A lot of people have kind of coined this the mental health pandemic, or the second pandemic. The emergency department has seen a big uptick in children presenting with behavioral and mental health need.
Dr. Jennifer Downs of Connecticut Children's tells Eyewitness News she's seen mostly teenagers in the emergency department, but has also treated kids as young as 6. Some patients have thoughts of harming themselves or others. Sometimes it's an eating disorder. Dr. Downs says this trend has been a national crisis for years, but the pandemic exacerbated what the hospital refers to as behavioral health, but is commonly known as mental health.
During the onset of the pandemic, the emergency department remained relatively quiet. Then in late spring, it saw a jump on top of this chronic national problem. That's around the same time developmental pediatricians saw more referrals.
Unless your child is an immediate risk of being a danger to themselves or others, we don't want to send them to the emergency room.
Instead, Dr. Rob KEDER, a developmental behavioral pediatrician, says contact your child's pediatrician. If an emergency, call 211, which can connect you with mobile crisis. He says the pandemic is creating toxic stress, which can ramp up your adrenal glands and cortisol levels.
With what's going on with the pandemic, I mean, this is what families who live in countries at civil war understand.
Dr. KEDER breaks down some of the signs that might indicate a child is having a problem. For toddlers, he says that could be tantrums, crying, clinginess, or behavioral regression. For school-age kids, you might notice changes to their eating and sleeping schedules. Connecticut Children says teens may become withdrawn, experience mood shifts, or have a change in interests. If your child is experiencing any behaviors that don't seem normal, Dr. KEDER says talk about it. If it's isolation, he says it's okay for parents to share they're feeling alone too.
Oh yeah, I miss my friends too. Maybe let's call so-and-so up on Zoom and see if we could do a video chat.
While parents like NOUJAIM are trying to help their children navigate this time, he's also thinking of the future.
I feel like this is going to have a lingering effect for, several years on these children that have gone through it.
Shante Passmore, Channel 3 Eyewitness News.